Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to discuss the use of Electrosurge in orthodontics. Now, a lot of people like to use a laser. I never did care for the laser very much. I used them some, but they were too slow and didn't really take the tissue off like the Electrosurge would. So I use Electrosurge in preference of the laser. And let me show you how it's going to work in orthodontics. There are many things you use the Electrosurge for, like you making openings for impacted teeth was one of the main things that we use them for. Let's go ahead and we'll show this case. This is the one. I'm not selling them, but anyway, this is the one we had, and this is the main tube that we used in this, and this is a little tiny wire that goes in here, which is I think this is a precious metal wire in there. It's hard to get this, and you can run this out. Now you can bend this little wire like any way you want to with it, and you go in and cut the tooth where you're making a hole for that. You can bend that little wire and go around in that, and it'll cauterize the hole as you get to the tooth. Now I made a small hole, but when I'd send them to an old surgeon, they'd make a bigger hole. And this is just the reading on the deal. Here we've got this tube right here, and we can pull this wire out where we want to and bend it in whatever shape we want. And you just lay it down. I think it's on a mirror, and we'll go back and show that you take it straight, and then you bend it down, and now you can come in and trim the tissue behind the tooth, an impacted or partially impacted second molar, and you want to get a band on this tooth as soon as you possibly can. So we'll come in here and we can trim this tissue off and come out of it. This is a mirror shot from that, showing that. And we've got the separator sitting in here that goes under the tooth. And we're going to come in here and trim this back. Now, looking at it like this, now, if you look at a skull, the wisdom tooth is usually behind. The bone structure will start over on here. So you've got some space between the bone structure, and you can trim it away and save a lot of your wisdom teeth. You can save them that way. Now this is a mirror shot coming in from here. Excuse me. All right, we take this Electrosurge and we figure out where we're going to go. So we go in and infiltrate around this area with this, where we're going to take the tissue off. And I take get it deadened and numb, and the tooth is separated, and we're going to put a band on that tooth. Some of you wonder how you got a band on there. You certainly can't get a bracket on it. So we took the Electrosurge now and cut that wire and just went around and cut this all the way down here. If you touch the tooth with it, it doesn't hurt at all. I've never damaged the nerve in the tooth with the Electrosurge. When we open that up, run it down through here too, over on this side, and now we can come in and put your band on the tooth. So we've got it trimmed like that, and this cauterizes this tissue in here as it goes down, and you're bleeding, you wash it off, and if you're still bleeding, you touch the spot with that long wire like that, and it'll cauterize that area. Now here we come in and we put a band on this tooth. We go back down behind here, it's numb, and this will heal up and clear it out, and you'll be able to do it. And as the person grows, this will come out and open more. As the person gets a larger jaw, it grows back to the back like that. So here it is looking in the mirror, and give you a couple of different shots of it to see how it is. Then we can get the wire in here and come in and work with a band on that tooth. And this is the way we banded. Some of the people ask, well, how'd you get a band on that tooth? We take Electrosurge and do that. Now let me see, I think that's about where we got on that. I'm going to go over here to build a little white sheet, and frequently we will find teeth that have that are way down there. If we locate that tooth, draw what we do with the Electrosurge. We take that little wire like that, and you locate the tooth. Nowadays you have some really super good x-ray that'll show you exactly where the tooth is. We used to use a Panorex, and we'd look at it from one side, the old type Panorex, and we could tell just about where the tooth was. And so you locate that tooth, and we're going to draw the thing here, and you put, and we open a hole to it. Now, if you send them to an old surgeon, they'll open a big old space around like that. And I prefer not to do that, but you can do it and get to the tooth. And if you can get to the point of that tooth and bond one of these little lingual buttons on it and twist a wire about it. Now we use a 14, that's an 014 soft stainless steel wire, and twist it around the little button on here and coming out, and you uncover this tooth and make your hook before you do any bonding. And your hook will come out over here, and then you can twist it down. This will be a twisted wire right here, and that hook will hold 5 pounds of force before you straighten that wire out. And you can put that wire where you want it. You have it ready. Now you go down and expose this tooth pointed, and you put a lot of glue bonding material. You don't mind leaving the excess down in here, and we'll come up here and hook that. And you'll be pulling that tooth toward a space up in this area. When this gets up here, you cut the wire, bend it again, cut it, bend it, until you get this tooth all the way to that section, like that. Now we'll show that on a case we're going to bring up here next. So I thank you for watching this, and if you want to use a laser, it's just slower, and I didn't like to use them. I could do better with Electrosurge, so that's what we use.